My name is Yaneri Kurz, and I use she, her pronouns.
Sam Tom, I use he, him pronouns.
I'm here today to get screened for breast cancer. In the trans community, breast cancer and breast cancer screening is not talked about enough. Hi, good morning. I'm here to see Dr. Hazen.
Great, you can head right down.
Okay, thank you. So I'm really happy to be able to incorporate this into my medical upkeep. I'm honestly very nervous because who isn't nervous in the doctor's office or in the waiting area? But I prefer to know exactly what's happening with my body.
All doctor's visits are a little like, they create a tension because there's always a potential for like, oh, I did not want to have that news, but that's not what this is going to be.
Even though it is basic healthcare and basic screening for breast cancer to get a mammogram, it seems to be an area of medicine that is missed in the transgender and non-binary population. And I'm not really sure why this happened. Welcome, and it's really nice to see you.
I started taking hormones at 17 years old, and that journey I kind of went on my own. So I kind of turned over towards black market hormonal therapy, and I don't think my focus was really on the risk. It was more so affirming my gender and starting my transition as early as possible.
That totally makes sense. I think a lot of people are in your situation. Many people did turn to black market hormonal therapy, which basically means that you're not getting it through a medical provider. You're not necessarily checking your blood work, and you don't really know what the dosage is or exactly what's in it. That can be very dangerous.
Does that make me a higher chance of potentially getting breast cancer?
The 100% honest answer is I don't know. And the reason is because we don't really know what you were getting. Is there any family history of breast cancer in your family that you know of?
Yeah, unfortunately, my grandmother had breast cancer. She also had colon cancer. Luckily, she beat both of them.
Oh, great. Okay. With your profile and your family history, you would not need to get a mammogram until you're 40.
Okay.
The only thing that sort of may push it towards doing a mammogram a little bit earlier is the hormones that you took. Having a grandmother is considered a second-degree relative, so we could recommend that you get a mammogram if you are concerned about this and to give you sort of peace of mind. Does that make sense?
It makes sense, yeah.
Before I transitioned, I was very methodical and I had a mammogram every year. When trans people transition to female or have breasts, they have breast tissue and they need mammograms. And I don't think I even knew that up until recently. It didn't occur to me. And if it didn't occur to me, who has had a mammogram every year since I've been an adult, then it's really not occurring to a lot of people.
So I want you to talk a little bit about your transition process.
Yeah, I did this relatively late in life.
You did.
I did.
You did.
And
I would agree with that.
I was 66, and that's late.
So what prompted you to decide that at that age?
People, places, and things that felt like barriers disappeared for a variety of reasons. It just left my life. It also gave me the space to kind of like listen to myself, right? And go, okay, it's not just that I'm sort of masculine. I'm actually a guy. Yeah. Oh, I'm a guy. Oh, okay. And then the decision to do top surgery just made all the sense in the world. And it was, I will tell you, one of the easiest decisions I've made. I've had harder times picking lunch.
And now, do you remember what kind of surveillance you're supposed to have now that you have had top surgery?
I do not.
You do not. Okay, so I'm going to refresh your memory.
Do that.
So basically, you should, you don't have breast tissue there,
Right.
but I may have left a few breast cells there.
Okay.
So your risk of breast cancer is not zero.
Right.
I guess my message is anybody that has breast tissue, regardless of how you identify and your gender identity, it needs to be screened. But basically, you just need a physical exam every year.
Yeah.
And if anything changes, if you notice any changes in
Yeah.
the chest, once you're past the post-op period, it should be stable.
Yeah.
Just like, so if you notice a lump or a bump, then you would see me or another breast surgeon.
Okay.
And it would probably prompt like an ultrasound.
Okay.
But because you're flat,
Right.
you can't get a mammogram anymore.
Right.
And you don't need to.
Right.
Because I did
Right.
a real mastectomy.
What surprised me was the fact that something that I did when I was younger could potentially make me higher risk for getting breast cancer. It's unfortunate, but I'm very happy to be well informed about what's happening within my body.
Take care.
Bye. Take care.
Now I have a chance to be who I am. The world can see me as I am, as opposed to it just all living in my head, right? So that's pretty fabulous.